I think that all hospital staff should learn how to speak Te Reo Māori to some degree. I feel as though that they need this to be able to correctly pronounce Māori words or names properly, because if a patient wants to come in and try and help a staff member correctly pronounce their name, it can be quite degrading when they continue to get it wrong. And personally, I have experienced that myself, and I have seen it happen to many of my whānau, and it's not very nice. I would also think that it would be lovely to see people being more culturally inclusive, get rid of those stereotypes, and I'm more than happy to advocate for that.
As a young Māori wahine, my wero to you now is this: for our mātauranga Māori, rongoa Māori, to be recognised across all aspects of the health sector, and also for Māori to be employed, not based solely on qualifications, but more based on the skills and knowledge within our own cultural practices. At the end of the day, they are taonga that have been passed down from generation to generation, and we know what works for us as Māori. We don't need a signed paper to tell us when, what and how. Ko tēnā te mea nui ki aho. So in closing, I'll leave you to ponder on this, and I've always said this to everybody: what if the cure for cancer was in the mind of a Māori individual who cannot afford to attend a university and gain a qualification? Tēnā tātou.
We need to recognise that this moment is the only moment in which anything happens, and it's the only moment in which you can change anything. So because these people that will be at the Hui, I'm assuming will be very qualified, be working very hard, they'll be doing great work in their communities. And the challenge I'd like to put forward is that if you've got an idea, if you've got something that should come to the front, or an idea that you want to see implemented, you've got to use this moment right now. You can't just put it off into the future. So I think the challenge I would say is, what can you do now today to help shift mindsets? So yeah, I would tell people to just love this moment, whatever you're up to. Forgive yourself and create a positive, loving environment for other people to thrive on, and have the strength and mana to pursue what you want to do now.
Someone once said to me, to achieve equity, may have to be prepared to treat me a little bit differently. I think that is something that has stuck, and so my challenge to you is, what part can you play in ensuring that we're able to meet people's needs, to assess and give people the skills, the strength, the mana, uplift them to carry on their journey? What part can you play in ensuring that people on a whole are getting the best outcomes every time that they seek healthcare or need to access healthcare? Where do you stand, and what can you do? Because we all have skills, and what are you willing to contribute?
If we want to lift Māori health, then we need more Māori health professionals, because Māori patients deserve the medical professional of their choice.
So what I would challenge you to do is to think big and to think long term. So a lot of health moves quite slowly, a lot of change moves quite slowly, a lot of policies are quite hard to shift. Don't just settle for small improvements. Think of your utopia and aim for that. That seems like a hard ask, but if you put yourself in the place where that utopia actually exists, you realize it's so worth it. So when you're thinking of these health policies or any space where you can make change, really aim for big change, aim for long-term change, and aim for change that really benefits the health of our whānau, and prioritise that first.
Our tipuna worked so long to set the foundations that we now stand upon, and it is our duty now to uphold it, to keep the reo, to keep Māori culture alive, to incorporate it into not only our homes, our schools, our churches, but our workplaces. Normalise te reo, normalise tikanga, get a better understanding of viewing the world as Māori do.
All I want is for those with a disability to be listened to and understood, to not be judged and to not be treated differently to anyone else.
I would like to challenge your thinking today surrounding the commitment and accountability we hold on ourselves and governmental bodies to execute and pledge their commitment to reducing health inequities for Māori. So what universal policies are in place throughout our society to break down barriers for our people to access healthcare or to become a healthcare professional? What are we as Māori and non-Māori doing in action that is contributing to a system change to better the health of our people? What consequences are in place if this is not met? Are there consequences? How much longer can we let this slide when DHBs and other health providers are not meeting minimum KPIs for Māori? We talk a lot about by Māori for Māori and reclaiming mani motu hake, which is awesome. However, when we take a hold of that power, we must appoint the right Māori to represent the needs of our communities with the right intentions. So I think whakapapa just isn't enough in positions of power, and we must move past the whānau nepotism and appoint the best possible person for that role. So I think, just having the right people in power to make the right decisions with that power is really important in moving forward. We just need to hold ourselves accountable to the same expectations as we do for tauiwi at every level of the health sector.